Good afternoon, everybody. I'd like to call the Finance Ways and Means Committee to order for April 12th, 2022. Madam Clerk, would you please call the roll?
Representatives Campbell, Camper, Crawford, Faison, Freeman, Gant, Garrett, Gillespie, Hawk, Hicks, Hodges, Lamberth, Lynn, Miller, Ogles, Sexton, Shaw, Sparks, Todd, Whitson, Williams, Wendell, Zachary, Vice Chairman Baum, Chair Lady Hazelwood.
Here.
Madam Chair, you have a quorum.
Thank you. Do we have any personal orders or announcements today? Seeing none, we have 9 bills on our calendar, and we have several expansion requests. We will have those hearings immediately following the regular calendar. Item number 1 is House Bill 1852 by Chairman Boyd. Chairman Boyd, you have a motion and a second. You're recognized.
Thank you, Chair Lady and Committee. House Bill 1852 is a wonderful piece of legislation. It has creates a framework by which veterans of the armed forces can actually get time in the Tennessee Consolidated Retirement System. It has been a work in progress since 2020 in collaboration with the Treasurer and with TCRS. And to give you a brief background, if you served in the armed forces of the United States prior to 1975 and you came to work for state government or local government that used the TCRS, you were given up to 4 years at day for day credited toward your retirement at no cost to the employee. 100% of that was absorbed by state government or by the local government that they were covered by. That stopped after 1975, and there have been several attempts to make changes to that statute over the years. But like I said, we have put a lot of thought into this with the TCRS, with the Treasurer, and we've come up with a plan that we think might work. And just like the TCRS was, we came out with a hybrid plan in 2014. This is kind of a hybrid military program. And so what it would allow is members that have served during certain periods of armed conflict after 1975 are eligible to buy up to 4 years if they have service during that period of armed conflict. It is not paid for by the state and local government like before. On this new program, it would require them to pay 9% of their current salary for each year that they want to buy. Madam Chair Lady, I'll take any questions that the committee has.
You've heard the sponsor's explanation. Leader Lamberth, you're recognized.
Thank you, Madam Chairman. Chairman, thank you for bringing the bill. I know this has been a labor of love for you ever since you got to the legislature, and anything we can do for our veterans is always a vote well taken down here. So I just want to thank you as a sponsor of the bill. Your constituents back home are very lucky to have you down here, and I know every veteran in the state of Tennessee will certainly appreciate a bill like this. So thank you for bringing it, sir.
Thank you, Leader.
Are there questions? Other comments? Seeing none, you've heard the sponsor's very thorough explanation. I would just add to Leader Lamberth's comments. This has been a work in progress through a number of committees. We've heard this, and the Chairman Boyd has been very receptive to suggestions for changes and ways to work this through the system. So I appreciate his willingness to work to get it done. Without objection, we are voting on House Bill 1852. All in favor, please signify by saying aye. Aye. Any opposed? The ayes have it. House Bill 1852 moves on to calendar and rules.
Thank you, Madam Chair Lady and Committee.
Item number 2, House Bill 1018, Chairman Halford. The owner of Lake Halford, you have a
Thank you, Beth.
you have a motion and a second. Chairman, tell us about your bill.
Well, this bill has a little bit of history. It was first voted for and passed in 2019, but there were a couple of items left out. It was heard again in 2020, but it never made it through the Senate. So here we are again today in 2022, trying to get these two little items on this bill so it can complete its journey. We left out the 4-year background check, and we left out the renewal fee in 2019 when this was originally passed, and this puts those two items back into the bill.
You've heard the sponsor's explanation. Are there questions? Seeing none, we're voting on House Bill 1018. Moving on to calendar and rules. All in favor, please signify by saying aye. Aye. Any opposed? The ayes have it. House Bill 1018 moves on, and hopefully the Senate will do the right thing this time.
Thank you, Madam Chairman.
Item number 3, House Bill 1689, Chairman Holsclaw. We have a motion and a second. Chairman, you are recognized.
Thank you, Chair Lady. Do you also have a couple of amendments that you're looking at?
But we have 5 amendments, I believe.
5? Okay.
The first one I have is drafting code 016977. It's by
Yes, please.
Representative Lynn. Representative Lynn isn't here right now, so we'll move that amendment to the heel of these amendments.
Okay.
The amendment number 2 is drafting code 016911. Just a moment. Drafting code 016911. Chairman Williams, you're recognized.
Thank you, Madam Chair Lady. I apologize for my tardiness. This also authorizes the Grand View Lodge in Van Buren County the ability to sell alcoholic beverages.
Any questions on the amendment? Seeing none, we're voting on Amendment 016911. All in favor, please signify by saying aye.
Aye.
Any opposed? The ayes have it. 016911 is now attached. Amendment 3, Chairman Holsclaw, I believe that's yours. 016.
016991.
Yes, my dyslexia was kicking in. I didn't see that extra 9. I thought we were looking at the same amendment. I apologize. 016991, and what does that amendment do, Chairman?
It authorizes Treetop Resorts of Sevier County to serve alcoholic beverages.
Heard the explanation. Are there questions? Seeing none, we're voting on the amendment 016991. All in favor, please signify by saying aye. Any opposed? The ayes have it. That amendment is attached. That brings us to amendment number 4, also by Chairman Holsclaw. And Chairman, I have 017193.
That is correct.
Okay, we have a motion and a second. You want to tell us what this one does?
It authorizes Clarksville Country Club in Montgomery County to serve alcoholic beverages.
You've heard the explanation. Are there questions? Seeing none, we're voting on amendment drafting code 017193. All in favor, please signify by saying aye. Any opposed? The ayes have it. All right, that brings us back to First Amendment, drafting code 016977. Chairman Williams, I believe you're going to present that.
Yes, thank you. Thank you, Chair Lady members. This, I'm running on behalf of Representative Lynn. This authorizes the Cedar Creek Yacht Club in Wilson County to sell alcoholic beverages on the premises as well. I'm happy
Heard
to
the
answer.
explanation. Are there questions? Seeing none, we're voting on Amendment 016977. All in favor, please signify by saying aye. Any opposed? The ayes have it. That brings us to Amendment number 5. By Chairman Holsclaw. It is untimely, but without objection, we will hear the amendment. Chairman Holsclaw, you have a motion and a second. You're recognized.
It authorizes Bumpus Mills Marina in Stewart County to sell alcoholic beverages on premises.
You've heard the explanation. Are there any questions? Seeing none, we are voting on drafting code 017102. All in favor, please signify by saying aye. Any opposed? The ayes have it. All right, we have placed 4 amendments on this bill without objection. I'm sorry, 5 amendments on this bill without objection. We will roll all 5 of those into one amendment. Is there any objection to doing so? Hearing none. So moved. Is there any discussion on the bill as amended? Seeing none. All those in favor, please signify by saying aye. Any opposed? The ayes have it. House Bill 1689 moves on to calendar and rules.
Thank you, Chair Lady, and the committee.
That brings us to item number 4, House Bill 2849, Chairman Kumar. We have a motion and a second. We have a motion and a second. Chairman Kumar, you're recognized.
Thank you, Chair Lady. The amendment on this is 13746.
That amendment is traveling with it.
Okay, thank you. This has to do with physicians that come to the United States and are foreign graduates, but they're here for short-term learning experience. And this bill allows the Board of Medical Examiners to issue an eligible physician of a medical graduate from foreign country that has been verified and recognized and approved by the AMA. And they are given a short-term 90-day training license so they can function in their capacity in a clinical setting.
Heard the explanation. Do we have questions? Seeing none, we're voting on House Bill 2849. All in favor, please signify by saying aye. Aye. Any opposed? Ayes have it. House Bill 2849 moves on to calendar and rules.
Thank you, Chair Lady and Committee.
Item number 5 on our calendar is House Bill 751 by Chairman Moody, and we have a request to roll that 1 week. So without objection, House Bill 751 is rolled 1 week. Next on our calendar is House Bill 1914 by Representative Eldridge. We have a motion and a second. Representative Eldridge, you're recognized to
Thank
tell
you,
us
Chair
about your
Lady.
bill.
Thank you, Chair Lady. This bill is dealing with press in the polling places. And basically what it's doing is giving the County Election Commission the ability to adopt policies to credential media in the polls.
You've heard the sponsor's explanation. Questions? Question has been called. Without objection, we're voting on House Bill 1914. All in favor, please signify by saying aye. Any opposed? The ayes have it. House Bill 1914 moves on to calendar and rules.
Thank you, Chair Lady and Committee.
The next item on our calendar is House Bill 457, Representative Thompson. We have a motion and a second. And we do have an amendment on this bill filed by Representative Gillespie, drafting code 016806. Do I have a motion on the amendment? We have a motion and a second on the amendment. Representative Gillespie, tell us what your amendment does.
Thank you, Madam Chair. Really, all it does is I wanted to delete the section in Part A under 1 that just said online. I thought that was too broad, and it's continuing to allow credit cards, debit cards, and mobile apps to be used for bail. So I think I've talked with the sponsor, and I think everyone's on the same page.
All right, you've heard the sponsor's explanation on the amendment. Are there questions or comments? Seeing none, we're voting on drafting code 016806. All in favor, please signify by saying aye. Aye. Any opposed? The ayes have it. Drafting code 016806 is attached. Now, Representative Thompson, if you'd like to tell us about your bill as amended.
Okay, it's really, it's pretty much the same as it was. That we just took out those 2 words that we were really, Representative Gillespie was not comfortable with, and I can appreciate that too. But this, the current code says that bail must be paid to the clerk of the court only in cash, and this simply updates the requirement by adding commonly used and verifiable methods of payment by adding credit cards, debit cards, and other and cash apps as methods of payment.
Are there questions? Question has been called on the bill. Without objection, we're voting on House Bill 457. All in favor, please signify by saying aye. Any opposed? The ayes have it. House Bill 457 moves on to calendar and rules.
Thank you, Chair and Committee.
Next item on our calendar is House Bill 1544 by Representative Weaver.
Thank you. Thank you, Madam Chair.
We have a motion and a
It's always so
second.
welcoming.
Did I hear, I'm sorry, did I hear a motion and a second? Okay. Third, thank you, Leader Gant, for the third.
Thank you. And the fourth and the fifth. Thank you.
So we have a motion and a second. There is an amendment on this bill, drafting code 016817. Is there a motion on the amendment? We have a motion and a second. So Representative Weaver, if you would tell us what the amendment does, because I believe we've seen this bill before.
Yes, ma'am, you have. And thank you. And I'm my pleasure to tell you what it does. So this authorizes private non-commercial vehicle owners and lessees to renew their registration plates for a 20-month period rather than a current 12 months. And so has a little fee to offset the revenue otherwise generated by that of a 12-month registration. And this would begin January 1, 2023. It requires a 2-year plate to be issued upon payment of the registration fee and a fee equal to the cost of designing and manufacturing the plates. The F&A are going to try to figure out how they're going to do that, if they need to design a plate or maybe just do a tag with the year on the tag. That's up to them. But it authorizes an owner or lessee to elect the issuance of such license plate or tag, including the language "In God We Trust." That's all it does. It is also permissible by local bodies, so they can choose to do this or not.
All right, and I do believe, Chairman Weaver, that you may have misspoken. I think you said 20 months, and I believe it's a
I said
24
20.
months.
I'm sorry, 24. Yes, it's 2 years.
So,
Sorry.
With that correction and that explanation, are there questions? Representative Shaw, you're recognized.
Thank you, Madam Chair. Sponsor Yield,
Yes, sir.
is this permissive?
Yes, sir.
Thank you.
Okay, without objection, we're going to go out of session and ask for a legal answer, for legal to respond to that question, just to make sure that we're all clear. So without objection, we're out of session. And
Joel
Pardon,
Hayes,
clerk.
Office of Legal Services. This legislation is permissive in the fact that a owner or lessee of a vehicle can request this type of plate. But if the plate is requested from the county clerk has to issue the plate. So the locals do not have a choice as to whether or not to issue this plate or not.
To make it legal, I mean, to make it permissive,
That is not permissive,
it is not.
not to the local.
not to the locals.
No.
Representative, while we're out of session, okay, Representative Garrett.
Thank you. I'm curious the way the statute reads. Is this, if you decide to do a 2-year renewal, is that a special plate for that? Or are they just giving you a 2-year sticker? I'm just curious as why do we have to have a new plate if you're just renewing your tags or whatever the case be for 2 years?
This is actually creating a new specialty plate that is issued for a 2-year cycle.
And, okay, thank you. That answers my question. Thank you.
Leader Gant.
Well, Representative Garrett asked a similar question that I was going to ask. Would it be more efficient? And this may be a question for the sponsor if you want to go back in session.
All right, are there other questions of legal while we're out of session? Seeing Leader Camper.
Thank you. Thank you, Madam Chair. Joel you said it's a specialty plate, and normally when we do specialty plates like this, we will have a minimum purchase amount, where that special plate would have to get like 1,000 plates. Would this require a minimum number of plates to be issued in order to have this specialty plate? Or if
Leader
it's
Camp,
just one individual could do this and we would have to do it?
Leader Camper, generally those minimum order requirements, those are when we have the specialty plates or new earmarked specialty plates tied to nonprofit receiving funds. Other specialty plates like military plates, we don't have those minimum order requirements. And I do not believe this has a minimum order requirement as well.
Thank you.
Any other questions for legal? Seeing none, we're back in session. Leader Gant, did you have a question for the sponsor?
Yeah, wouldn't it be more efficient instead of issuing a new plate to just issue a 2-year sticker?
Representative Weaver?
Yeah, yes, and amen. I have talked to FNA, and they're still in that window of deciding how they're going to design or do, but I suggested it'd be very easy just to take a sticker and say the year that that plate would expire. Yes, and yes to your question, but it's not been made finite yet by the department.
Leader Gant?
Did they give you a reason what the issue was? I'm trying to understand. It's just a matter of instead of renewing in, say, 2024, it's going to renew in 2026.
Representative Weaver?
Simple would be the most logical answer. I agree with you, and that's what I suggested to them to do. But again, I haven't gotten a definite answer from them yet on that. So, Madam Chair, may I make a comment too?
Certainly.
So in regards to permissive, which the representative asked, I understand it's permissive, the local body, not the individual. But I was told that the local body, like the commissioners, can decide if they want to do this in their county or not. And that's not true, right? Well, I stand corrected.
It is not true as the bill is currently written.
Okay. Thank you, Joel.
Chairman Whitson, you're recognized.
Thank you, Madam Chairman. That was going to be my question. I thought your intent was permissive for the local body, not for the person. And that's why I voted for it, to make it permissive for the local body to decide whether they want to do this, so they could decide the impact on their number of employees, the costs and such, not to the person. Is there any way that we could maybe roll this to correct that language?
Sponsor, would you be willing to roll the bill and entertain an amendment that would make it permissive to the local bodies if that was your intent?
I am at the will of the committee. We'll do what we need to do. This bill has been back and forth numerous times. I would like to, if we could, I know I'm not in the place to ask this, but if the clerks would come up here and maybe ask that question. Usually they're here. Well, I guess we'll wait to the next to the next
Chairman Whitson.
meeting.
Yes, and I support this bill as your intent is
Yeah.
for the and also I like your idea. Just put a 2-year sticker on there to keep the costs. So I would request that you consider that fixing the language in the bill.
I have a motion to roll the bill 1 week.
Okay.
All right, we're going to roll the bill 1 week. And we look forward to an amendment next week. Thank you. Right. Okay, folks, we had some parliamentary questions up here, but the posture of the bill that we just heard, we were on the amendment. Our plan would be we roll that 1 week. We would come back next week. We would be talking about the same amendment. The sponsor at that time will have an opportunity to withdraw and place another amendment, hopefully that we'll have in a timely manner. So that's where we are. We are now on House Bill 2096. Leader Lambert. Leader Lambert, you have a motion and a second. You're recognized.
Thank you, Madam Chairman. This bill is very straightforward. It just allows us to require work requirements on able-bodied individuals that are on short-term assistance programs as permitted by federal law.
And we do have an amendment on this bill, I believe, drafting code 016983. I have a motion and a second. You want to tell us about the amendment?
Madam Chairman, that's, as I described, that's what the bill does.
All right. First, we need to do the question on the amendment, please.
On the amendment.
The question on the amendment, we are voting on drafting code 016983. All in favor, please signify by saying aye. Any opposed? That amendment is attached. You've heard the explanation of the bill. Leader Camper, did you have a question?
I did, Madam Chair. Thank you. Leader, I asked you this in budget sub, but I just wanted to ask again for the record that this bill is not going to put any federal funding in jeopardy, and it's kind of in line with what they're trying to do anyway with having people back in the workforce. Is that right?
Leader Lambert?
I've worked with multiple interested parties. I've worked with the department, in fact, 2 different departments. And I've been assured that there is nothing in this bill that will in any way endanger federal funding. It is what they are currently doing. It places in statute their current practices. And so their practice is if someone comes in and needs temporary assistance, then part of that assistance is to make sure they get a job or get job training. And that is what the federal program originally was set up to do back in, I believe, the 90s. And that is exactly what we should continue to do here in the state of Tennessee to ensure, again, that these folks don't need that temporary assistance. So I've been assured by all involved that this does not endanger federal funding. In fact, it matches with the spirit of the federal law.
Thank you, Mr. Leader, Ms. Chairman.
Other questions? Question has been called. All those in favor, please signify by saying aye. Any opposed? The ayes have it. House Bill 2096 moves on to calendar and rules. That completes the bill calendar for today. We're going to now proceed to our expansion request hearings. And first up, we have the Department of Health. And members, you do have on your dashboard, the presentations are available if you can't see the screen. And Deputy Webb, I believe you are our presenter today.
Yes, ma'am. Thank you, Madam Chair. Thank you, members of the committee. The Department of Health has 5 expansions, all federally funded, to present to you today. The first expansion that we'll discuss is related to pediatric mental health care access for adolescents and children. This is around $800,000 over a 2-year period. Funding has been provided by the Federal Department of Health and Human Services to expand the availability of access to mental health resources to children and adolescents. As you can imagine, resources in this particular area are slim during normal times, and the COVID pandemic has kind of exacerbated some of the issues that children and adolescents are facing. So the department plans to use these funds to contract with third parties to help train primary care physicians in assessing and addressing some mild to moderate behavioral problems. And with that, I'm happy to answer any questions on this particular one.
Chairman Williams, you're recognized.
Thank you, Director. I just had a quick question. I noticed on the breakdown of the 2 FY 22-23 that of this appropriation of what is that, $778,000 over 2 years, that $250,000 of it is going to professional services and dues instead of the grants and subsidies. It represents about $500,000 or $600,000. I guess, is this typical disbursement of professional services and dues that we're only spending say 60% of the money on the actual grants?
It's a great question. Really, I think when we look at the grants and the professional services, we're paying for services in both categories. One is for training services with the American Academy of Pediatrics. That'll probably be the grant. That's the grant portion of it. Another thing that we're adding into this is a kind of a telehealth, teleconference psychiatric service for primary care physicians so that they'll have access to that. So on that professional services line, we're paying for that service.
Chairman Williams.
Thank you. Is this partnership through individual practitioners or like the Child Health Alliance, Children's Health Alliance of Tennessee, or those children's hospitals? How does that work? Or
We'll work through the Tennessee chapter of the American Academy of Pediatrics to, I guess, help formulate the network with the pediatricians. And the actual services for the psychiatric or mental health needs will be through UT Le Bonheur.
Okay, thank you.
Are there other questions? And I would note there are no additional positions in the department associated with this.
That's correct. That's correct.
Any other questions? If you want to, we'll move on to your second request. I believe it involves qualified healthcare centers.
Yes, ma'am. This money is from the American Rescue Plan. It's for the state-operated federally qualified health centers. This is about $9.2 million over the next couple of years. The funding was provided to the state to, I guess, implement mitigation strategies for COVID-19 or expand infrastructure for healthcare services. The state operates FQHCs in Gibson and Stewart counties, and those particular FQHCs will be purchasing mobile clinics to be able to take services out to people in the community, along with some equipment and some other needs that they have at the local sites. The other FQHC is our Upper Cumberland FQHC. They'll be using the funds to help hire some contracted staff, some minor renovation and construction projects for some of their needs, and then some of the equipment and supplies that they need to help promote telehealth and teledentistry. With that, I'm happy to answer any questions on this particular expansion.
Are there questions? Leader Camper.
Thank you, Madam Chair. Thank you for this, for the information. Question on the mobile clinics that'll be going out. Will they be fully staffed and all of the services that they will provide be as if you're walking in a brick and mortar building? Will have all the services and everything available to the people that they're serving?
Yeah, Leader Camper, it's going to be directed towards primary care services. So as close as we can get to that in a mobile clinic, that's what we'll do.
Thank you. Thank you, Madam Chair.
Are there other questions? And I apologize, it's allergy season in Tennessee. That brings us to item number 3.
Yes, ma'am. Our next item is from the American Rescue Plan as well. It's a CDC epidemiology and lab capacity grant. We actually have 4 grants tied into this. It's the same funding source. It's $21.2 million over the next couple of years. And we're taking these funds and addressing 4 major issues. One, we're supporting efforts to mitigate the transmission of COVID-19 among people experiencing homelessness. The department is going to provide grants to community organizations for testing and mitigation efforts, cleaning supplies, PPE, and education and training materials for staff. And we're really going to focus those efforts at overnight shelters, emergency shelters, meal sites, et cetera. Our second main tenet of this grant funding is to support mitigation efforts at major transportation hub sites. We're actually going to use this money to work with Metro Nashville Health Department at BNA and promote a media campaign and supplies related to COVID-19. Our last 2 tenets really deal with the healthcare facilities. One is just in healthcare facilities in general. We're going to provide assessments, support, and mitigation strategies for healthcare facilities. And some of that would include equipment and laboratory supplies that are needed to help test for COVID-19. And then the other kind of piece of that is really we're going to try to put in some infrastructure for long-term care facilities to support some of their mitigation efforts in the future. So with that, I'm happy to answer any questions about that expansion.
Leader Gant.
Thank you, Chairman. You mentioned the airport and media campaign. Can you drill down into a little bit of what that's about?
Yeah, the total grant is about $400,000, and I don't know off the top of my head about how much of that is dedicated to the media campaign. But what I understand is there's poster space that we would use to advertise, about being safe or taking precautions with COVID-19. And then a lot of times, I think Clear Channel runs the music and the speakers in there, and we would probably have some ads about COVID awareness on that.
Chairman Williams.
Thank you. My apologies. I lost my place, Chair Lady. On the breakdown of this, I noticed in line 708, you have professional services to a third party. Of the $21 million, it looks like $11 million is going to this one entity. Tell me what that professional services party does. This is not to pay for ads, I suppose.
That's correct, and that would be a small portion of that service. This is when we look at this breakdown of the object code level when it's professional services. This is the cumulative effect of all four of these grant proposals. One major portion of this is going to be some of the work that we do with training for long-term care facilities. We're going to host trainings here in Nashville, and then we're also going to hire third parties to go out regionally and discuss COVID mitigation strategies with long-term care facilities. So that would be one big component of that professional service line. And if you would like for me to get a more specific breakdown, I can do that and respond to the committee.
Thank you, Deputy. I do think that would be extremely valuable as we look at these funds as they go out. Hopefully, as we know, our long-term healthcare facilities have become subject matter experts in these fields, and so spending another $21 million to further educate them, I think, would be important for us to know where that $11 million is going.
Sure.
Thank you.
And I suppose there's a reason. Is it just departmental, lack of resources within the department that prevents you all from doing that training internally?
That's correct. We can do some of it, but we need additional help to do that, and that's why we would engage third parties to do that. But I'm happy to get a breakdown of that third party if I need to.
And I think that would be helpful to some of our members.
Yes,
Chairman
ma'am.
Hawk.
Thank you, Madam Chair, and thank you very much for presenting this to us. If I could go a little further on Chairman Williams' questions in the letter that was sent to us on February 17th of 22, I know there is not a request for any state employees to be hired, but there is a paragraph that says the ELC Homeless Services site grants would be used to hire workers to coordinate resources, et cetera, et cetera. I'm going to have a concern with some other conversations we're having about these expansions. So is the ELC Homeless Services, they are going to be hiring people, and in what capacity will they be hired, and what happens when the money runs out?
Great question. We will probably the department will hire temporary staff to help coordinate this grant. And then as an allowable expense of the grantees or the partners we're working with in the community will have the ability to hire temporary workers if they need to. This, as far as I know, is a 2-year grant. We'll probably get a no-cost extension because I don't know that we'll spend all the money within that period of time. But the state is under no obligation to fund these programs once the federal money goes away. So we've kind of built it and structured it as non-recurring money, and that's how we'll treat it unless we hear otherwise from the federal government.
Other questions? All right. Next up.
Our fourth expansion is from the CARES Act. It's related to our CDC Emerging Infections Program. It's about $1.1 million over a couple of years. In this grant, there's some supply costs in here, some laboratory costs related to it, but the grant primarily supports our data collection and sharing agreements with the CDC. I think in the explanation that there's a term COVID-NET, which is just the system that we use to help report along with 9 other states, COVID case numbers and trends and that sort of thing. So this just helps us expand training related to that.
And again, I would note, as on all of these expansion requests, there are no permanent positions involved.
Yes, ma'am, that's correct. No positions.
Questions on item number 4? If not, that brings us to item number 5.
Our final expansion request is related to the American Rescue Plan. It's maternal, infant, and early childhood home visiting grant money. It's about $3.4 million over a 2-year period. There are no permanent positions with this. And the funding was provided by the federal government to our current maternal, infant, and early childhood home visiting grant recipients to address the needs of expectant mothers or expectant parents and families with young children due to the COVID crisis. The department will partner with our current grantees that receive that particular funding source to ensure that families receive the supplies and things that they need. And we're talking about diapers, groceries, and those kind of emergency supplies. So that's the basis of the request.
I've visited with one of these grant recipients, and they truly have made a difference in the lives of a number of mothers and helped them to be a lot more self-sufficient. So from that perspective, it's a good program. And
Yes,
again,
ma'am.
no positions. Are there questions? Representative Sparks.
Let me ask you, are you seeing a huge rising cost of like baby formula? Are you hearing stories about that?
Anecdotally, we hear stories like that, but I couldn't give you an exact number on how it's impacted our program.
Yeah, my wife had just shared something, and it was just through the roof, the cost. I mean, I was just surprised. I didn't know what the alternative was when you have something like that that's required, that's a staple,
Right.
All right. Thank you, sir.
Yes, sir.
If there are no other questions, Leader Camper, do you have a question? Okay. All right. Thank you so much.
Yes, ma'am. Thank you very much.
Next on our list, from the Department of Corrections. And we were expecting Ms. Helton, and obviously she isn't here. So, but we're glad to have you.
Yes, ma'am. On behalf of Commissioner Helton, she is ill and was unable to make it today. My name is Bo Irvin. I'm the Chief Financial Officer for the Tennessee Department of Corrections. This budget expansion request is pretty straightforward. Madam Chair, Lady, and members, the Department of Corrections is requesting a budget expansion of $288,800 for fiscal year 23. In 2019, the department was awarded a swift, certain, and fair grant by the U.S. Department of Justice, Office of Justice Programs, Bureau of Justice Assistance. The SCF grant initially expired in September of 2021, and we did receive an extension that expires in September 30, 2022. And we're in the process of submitting another grant extension that will go through September 30, 2023. But this expansion request is strictly for $288,800 to be available for use in FY23. In January of 2017, the department developed and implemented a graduated sanctions matrix as part of the Governor's Public Safety Act of 2016. The matrix was developed with evidence-based research and standardized probation and parole officer responses to technical violations. The SCF grant provides the department an opportunity to enhance the current matrix for substance use population under the correctional control of our department. We experienced challenges primarily associated with COVID-19 as well as staffing issues since the grant was awarded. This resulted in delays in completing the action plan, the full budget, and other required deliverables. We are now better positioned to gain traction on the items necessary to move forward with this grant. At this time, I'll entertain any questions.
I do see that you're adding a position for what is you know, a grant that has to be renewed it's a non-recurring grant, but you're adding a full-time position.
Yes, but they'll be aware that it is grant funded.
What happens to that position if the grant runs out or is not renewed?
That position would go away.
Are there other questions? All right, thank you so much. Next up, Director Dunn, the Commission on Aging and Disability.
Madam Chairman, members of the committee, James Dunn, Executive Director with TCAD, and I have with me Ms. Gail Wilson, our Fiscal Director. We have brought to you today an expansion for 5 positions. It's all federal dollars to the tune of $700,000. This is from the American Rescue Plan to assist with CARES Act funding. They are temporary and will last 2 years.
So when the funding goes away, the positions go away.
Indeed, yes, ma'am.
Are there questions? Representative Miller.
Thank you, Madam Chair Lady. Understanding these are temporary positions and they are to assist in CARES Act funding?
Yes, sir. That is correct. We could walk through some of this with you if you'd like as to what those positions are. We have an aging program consultant. This is to improve upon the home and community-based provider relationships statewide. We have another position similar that assists with other various COVID-19 funded programs. We have an executive administrative assistant, 1 and 2, and legal assistant. These folks will be assisting with funding under Older Americans Act funding and COVID funding, assisting with contracts and things of that nature, and our state long-term care ombudsman. That's sort of the scope of these positions.
Okay. Thank you, Madam Chairman.
Other questions? Seeing none. Mr. Dunn, thank you for coming today, and Ms. Wilson.
It is always a pleasure. Thank you, Chair Lady.
Next up, the Department of Children's Services. And while you're obviously not Commissioner Nichols, we welcome you too. Could you check and make sure I don't think your mic is on.
Is it better?
Yes.
Mohammed Al-Kaisi, Assistant Commissioner of Finance and Budget, and I'm here to present the expansion request for the Promoting Safe and Stable Families, and it's $1.7 million that we received. This is part of an existing grant that the department receives every year, but this is an expansion that we received from the feds, part of the Consolidated Act of 2021. And this funds will be used in 22 and 23. And this funds basically is used for family support services for children in custody, and also is used for children at risk of coming to custody. The proposal for the use of this grant is we planning to use it in 2 major items. One of them is for daycare for children at risk. And the second part will be used for recruitment of foster parents, which currently the department having a problem of recruiting foster parents. So we're going to expand our effort and funding to use for those particular 2 purposes.
All right, members, you've heard the explanation. Are there questions? Leader Camper.
Thank you, Madam Chair. On the program dealing with preventing children from coming into custody, can you talk a little bit more about that?
Yeah, those will be children that are not currently in custody, children that we do CPS investigation, or we are finding that the family has risk for, children has risk of coming to custody. So that will not be for anything that kids are currently in custody.
Leader Camper.
Thank you, Madam Chair. But you have some programs that if you're investigating someone or family and you see that there needs to be some programs put in place for the child that may, or the family,
Right.
parents, that they can enter into, that as a result of it, it'll help the families and then the child will not come into custody.
Yes,
Those are
that's
the-
exactly, that's what the daycare is one part of the two programs that we are proposing, is helping family to access daycare while they have, allowing them for employment, full employment.
Okay, thank you.
Leader
Thank you, Madam
Gant.
Chair.
Thank you, Chairman. You mentioned the money that goes toward daycare. What happens when this money goes away? Are those parents or the daycare going to be cut out at that point? Tell me about that.
Well, currently the program exists, but it's very small scale, so we're going to expand it in this year and next year, and we'll see the results of that program. If the program turn out being a very successful program, we will request it in a new budget, in 24 budget.
Leader Gant.
So we're going to go out there on the limb and we're going to provide this, but there's a possibility that we could pull it back if we don't bring that into the state budget. Is that correct?
Well, we currently providing the program on a smaller scale, but since we have this funding exists now, we're going to expand the program.
Leader Gant.
Yeah, I just don't like to set the precedent where we're given something and then we just take it away. But that's what you're saying potentially could be the case
Potentially, if
we don't add more
decided-
money into the budget.
Yeah, currently, actually, the governor has added to the budget for adoption. They added daycare for adoption, and also the governor added for custodial children. So that is the only part that is we have not had a full funding for is the children at risk, which is the non-custodial program.
Okay, thank you, Chairman.
Representative Miller.
Thank you, Madam Chair Lady. Sounds like a great program, but I want to follow up somewhat on the 885,000. Initially, these are federal dollars.
Yes.
Did the department submit a grant application? Was it any matching funds when we approached the federal government about this?
Well, actually, those has no there's no state match. They all 100% federal funded.
So once the program is proven to be successful, you would in fact approach the federal government again for possible grant. You would certainly do that, correct?
Or we actually request state funding for that program for 2024.
But you wouldn't.
I mean, this fund will expire in
Right.
2023, so we will not be able to get an additional funding for those. Those are part of the Consolidated Act. So that's not a funding that we applied for.
This federal funding is temporary.
Okay.
That's a temporary federal funding.
Right. Okay. Thank you. Thank you.
And there is another issue, certainly, Director Casey, there's just daycare options are very limited. So being able to place these children in daycare simply because of the availability of quality daycares is another difficulty. Are there other questions? Seeing none, thank you.
Thank you.
Last on our list, Mr. Perry with Tennessee Housing Development Association, or agency, I'm sorry.
Thank you, Madam Chair, members of the committee. I'm Ralph Perry, the Executive Director of the Tennessee Housing Development Agency. Our Chief Financial Officer, Trent Ridley, is with me. Pretty straightforward. We're asking for 31 additional positions, and that's a large number, so I want to be able to give you a little bit of context. These are positions that will help us administer the new and expanded federal programs that we've been tasked with over the past 2 years. The cost is fully covered by those federal dollars, so there's no impact on the state's budget. And because all of these positions are directly linked to one federal program or another, and many of them will expire over the next 2 to 5 years, our intention is that the positions go away as the federal programs do. We administer a number of federal programs now on the state's behalf. We've talked about a number of these in earlier meetings. A number of them were very significantly increased over the last couple of years. We have 10 times as much money for emergency solutions grants, 4 times as much for home, 11 times as much for weatherization. And on top of that, we were given a number of very large new programs that we had to stand up from scratch, including the big rent relief and homeowner assistance programs. That's a significant amount of additional work for our staff, as you can imagine, and not just in the program divisions, but in the support divisions like accounting and IT. We have been able to use temporary employees, but as you know, labor law requires that if the temps are going to be with us for more than 6 months, as many of them will, we're required to classify them as long-term temporaries, and they count against our authorized position count. We have 23 of those positions right now, and over the course of the summer, we'll need to reclassify another 8 to 10 short-term temporaries. And we won't easily be able to absorb that without cannibalizing other aspects of our business to the detriment of the work that, frankly, you all chartered us to do in the first place. I do want to emphasize that before we come to you and the governor asking for this number of additional positions, we've taken a number of other management measures to manage this additional workload. We've, on a number of occasions, when people resigned or retired, reclassified positions to put those to work elsewhere. We subcontracted the contract administration work that we do for HUD. That freed up about 15 positions. We anticipate a further reduction in force of maybe a half dozen positions where we can repurpose those positions for more urgently needed purposes. And we continue and have reorganized some business units and streamlined processes to work more efficiently over time. We will put these positions to work very effectively in the program and support divisions most impacted by the extra work. While they're with us, they'll be extremely helpful to us in administering these programs, but also making sure that we do our core business and program responsibilities well. I'll pause there. Be pleased to take any questions that you have for us.
Are there questions for Mr. Perry? Leader Gant.
With all this federal money that's coming in and we're expanding, what happens 2 years from now when we've become so dependent upon this additional resources? What's the plan then?
Well, my plan is when the federal program money goes away, those positions go away and the program itself goes away. I mean, most of these were intended to be short-term programs, relief for people who lost the ability to pay their rent because of a COVID-related situation. Same thing for mortgage holders. Some of these will stick around longer. The new household water program is a new permanent addition, so that'll be with us. We anticipate the expansion of the voucher program will be more or less permanent, so that will be with us. But the bulk of these positions are dedicated to the programs that we had to stand up in a hurry, that were high volume, rent relief, homeowner assistance. And when those programs end, that's the end of the program and those positions will go.
So going into this, it's a temporary thing going in. So you've got an end in sight for this. Okay, thank you.
Yes, sir.
Chairman
Well, that's
Williams.
what they tell us. We've run other temporary programs that hung around for about 8 or 10 years, but that's what we're hearing now is 2 to 5. Pardon me, ma'am.
Chairman Williams.
Thank you. The federal government does have many temporary long-term programs. Director Perry, thanks for coming today. I just thought I'd follow up. It has nothing to do with your expansion request today, but I noticed when this is the first time you've been back since your budget hearing earlier. And I think if I remember correctly, there was almost $3 billion maybe that THDA got in federal funding, or you had like $1 billion or $700 million, something like that was unused. Is that what these funds are going to be going to, that program? You communicate
Some.
the 31 positions.
Yeah.
or for programs. I guess, what is an example of those programs?
The Homeowner Assistance Fund, which we just launched in January, that will provide assistance for people who fell behind on their mortgage over the last 2 years. The Rent Relief Program we've had up and running for a couple of years. We subcontract out for a lot of the intake work, but that still takes a significant number of people doing our end of that work. And we've backfilled with different positions and relied on temporary help to do that. We have been juggling, playing the hand we were dealt over the last couple of years, leaving other positions unfilled so we could bring in long-term temporaries to address these federal programs. But there's, home, another 50 million, 30 million for ESG. Pretty soon we're talking about real money. And it's well over $1 billion that we're charged with.
Okay.
Chairman Williams.
Thank you. I would be remiss if I also didn't say thank you for your support for Habitat for Humanity in our state as a member of the board there. It doesn't matter if you're John Gillespie's district in West Tennessee or John Crawford's district in Upper East Tennessee. What you guys are doing all across the state is fantastic. And so I appreciate all the work that you do. Thank you.
Thank you, sir.
Are there other questions or comments? Representative Sparks and then Leader Camper.
Commissioner, I live in Rutherford County. Many of us, I think Sam Whitson, Williamson, Charlie Baums in Rutherford County, you're seeing a housing just crisis, as we all know. I mean, it doesn't affect, I think, some of these lawmakers like it affects us. Where do you see things in 2 to 5 years? Because, I mean, it alarms me. I see us doing this Titan Stadium and these bonds, and we don't have a workforce, don't have housing. I hear it from the interns. I hear it from the LAs. I hear it from other folks in the community. How worried are you for the housing crisis in 2 to 5 years?
Well, we just got to build more housing, and we need to build it particularly in fast growing areas. I mean, you're not going to take pressure off rising rents or home prices unless we make it easier to build housing, particularly in entry level price points. We're still doing real well up in East Tennessee. We're doing better in Memphis. But our Middle Tennessee business, it is very hard for a first-time home buyer in a THDA bracket to easily find a home, and that's been reflected in our numbers. Multifamily, we only have so many resources, but we are putting those to work. But we have had to allocate a large chunk of this year's housing tax credits to help earlier tax credit awards from the last 2 years who were suddenly hit with enormous cost increases and weren't able to move forward with their deals. At some point, resources will be needed for housing development. That's frankly a larger issue than our agency can deal ourselves. And there are a lot of moving parts with that.
Yes. Well, if I can, Chairman.
Representative Sparks.
The bill that Dr. Baum carried a few years ago that expanded the bonds, how successful has that program been?
Oh, it's been enormously helpful. We are well below our bond cap, our debt limit, pardon me. We have about $2.8 billion on our books. We will add to that slightly over the next several years, but we are then shifting our principal means of financing mortgages to more of a secondary market execution. Without going into the weeds, it means we will not be entirely dependent on issuing bonds, and we don't expect that our debt load will come anywhere near the ceiling that you set for us last year. And thank you, Mr. Baum.
Yes, sir. Thank you, sir.
Leader Camper.
Thank you, Madam Chair. Thank you for actually bringing this, because I know I've gotten a lot of calls from people who could benefit from some of these programs, but they were on these lists where we didn't have enough staff to process them. They would call, they've been waiting a couple of months, they haven't heard back from anyone. So I do think it was a heavy lift with respect to the work that needs to be done. And I agree, we need to have the staffing in place because the citizens are in need of the services and in need of what you're offering. But if you don't have the staff to process it, I mean, it frustrates them. I mean, I've gotten several calls from people asking, can you find out the status of my application?
Yes, ma'am.
But it's because we don't have the staff to process it. So
Actually, Shelby County is running its own rent relief program. but I'm told that they're going to close it in a couple of months, and THDA will pick up responsibility of serving your constituents in
Yeah,
Memphis.
it's been a real challenge. So
Yes,
I
ma'am.
appreciate what you're doing. Thank you.
Thank you, ma'am.
Representative Miller.
Thank you, Madam Chair. Mr. Executive Director, following up on Representative Sparks' question when he asked, what can we do? What do we need in the next several years? You said build more housing. I would only suggest that as we build those houses, we be more strategic in where we build those houses.
Well, sir, a lot of that's driven by the private sector, as you know. You bet.
Seeing no other questions, Executive Director, I would like to note for the record, we heard you say it, but I'm going to say it again. These 31 positions, when the federal funding goes away, whether that is temporary for 2 years, 5 years, or 10, but at the end of that time, when the funding is gone, these positions will no longer be on the state payroll.
Yes, ma'am.
Thank you, sir.
Thank you.
Any? Oh, but Chairman Hawk.
Thank you, Madam Chair. And Chair Lady, I want to thank you for allowing us the depth of conversation on these budget expansion hearings. That wasn't always the case, and I really appreciate you allowing us to have these conversations, not only now, but throughout the year. Thank you very much.
You're quite welcome. All right, we have no further business in front of the committee, so without objection, we stand adjourned.